Hello, everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in healthcare IT. And today's guest is Sam Hanna. He's EVP of Consulting and Innovation and also the Chief Strategy Officer at Divurgent. Welcome, Sam.
Thank you, John. Great to be here.
Yeah, so excited to dive into innovation and leadership. I think we have some great topics today. But before we do that, tell us a little bit about yourself and Divurgent.
Fantastic. Thank you. I would say I am a lifelong learner. I recently received my PhD in translational health. And what that really opened my eyes to is how much technology and innovation and healthcare come together, especially in this world of COVID and post-COVID, hopefully very soon. So a lot of what we do at Divurgent is really reinventing that healthcare consulting experience with our clients to focus on their client business imperatives, what makes them tick, what they need to do, and what their value proposition is to their patients, to their clinicians, and to their stakeholders and communities.
Yeah, great. So, I just interviewed a CIO for our CIO podcast, and he talked about the importance of collaboration. So what do you see really as the key to kind of developing collaborative leadership as a CIO at a healthcare organization?
Sure, that's a great question, and it's very relevant in this day and age. As you know, probably, and maybe he or she mentioned this, a lot of the technology budgets have evolved to go from the technology team, the CIOs group, to the operations, the clinicians, the administrative offices, revenue cycle, and others. And with that evolution, a lot of the decision-making authority, the influence had gone with it to these various other organizations. So as a CIO, to be successful, you really have to be thinking like a business person, beyond IT, thinking about building coalitions, understanding what the influences are, who the stakeholders are, and how you will be able to create these teaming approaches that allow everybody to succeed and demonstrate the ROI around these initiatives that you're working on.
Well, and I think that really is the challenge of being a CIO, because initially it was just a tech position, but now it's tech, it's business, and it's clinical. I mean, is that what really drives the challenge of being a CIO and kind of collaborating across those domains?
It does. And I would also add to all of these things you mentioned, innovation. They're also expected to be innovative and to bring new tools, new technologies, especially around digital, to the enterprise. So they have to do all of these things and they have to manage them. And to do that, again, they have to really understand their consumers. Who are their customers? Their customers are the business units, the clinicians, the administrators, and the patients. So it's no longer just about the patient experience, it's about the clinician experience. It's about the value proposition that you bring to all of these stakeholders. And to do that, you have to understand them. You have to really know what their priorities are. You need to build these coalitions, like I mentioned, and really understand where people are coming from. Yeah. We often hear this term, put yourself in the other person's shoes, right? So as a CIO, if you're dealing with the revenue cycle director or the CFO, you have to really understand the metrics, the revenue drivers, the growth drivers that they are looking at and the constraints that they're under to understand how you can be a better servant leader to them.
Yeah.
And vice versa.
I think it's interesting you mentioned innovation, because sure, you could have an innovative solution to how you roll out desktops, but the most impactful innovations in healthcare span all three of those. And that, you can often find conflict between those different organizations and the goals of those organizations. So is that what you would say if if you're dealing with this conflict, what skills do you need? I mean, it sounds like you mentioned one, understanding and being in their shoes. Are there any other skills you need to kind of work through conflicts between these different business, clinical, et cetera, areas?
Sure. The first one that comes to mind, and I think one of the most important skills, is communication. Being able to communicate not just what you need from them, but understand what they need, ask the right questions, and then reinterpret that, to them as to what you're hearing, so you can arrive at a consensus model of what they need versus what you think they need.
Yeah,
That's
definitely.
one. Second would be teamwork, just being a team player, being, thinking with the goal in mind. And it's not an us versus them mentality. It's a, how can we together arrive at this new goal? That's critical. If you don't know how to team, or if you don't know how to build that coalition, then that's going to be detrimental to the value that you bring to the table. You mentioned things like desktop support and computers. Most of these things are table stakes, right?
Yep.
So if you're, pounding the table as a CIO and say, well, we deployed, 2,000 laptops in the last 6 months, that's great, but that's expected, right? What is the value of deploying these 2,000 laptops? What did that do to the organization in terms of efficiency, effectiveness, user experience, impact? Those are the numbers, and these are the things that you need to be thinking about and communicating, because that's how these things are measured. It's not about the number of deployments, it's about the impact of these deployments.
Yeah, I mean, it's interesting you talk about, kind of all of the efforts that a CIO can do and the impact that they can have. But how does a CIO balance all of these competing priorities, clinical, revenue cycle, administrative? I mean, they all have benefits. So any suggestions on how a CIO can kind of balance those competing priorities?
Well, it's not an easy task, that's for sure. And the reason it is not an easy task is because there are so many constituents. And as you know, healthcare is evolving very fast. Healthcare technology is evolving even faster. And innovation is happening from all directions. So the CIO, first and foremost, has to be aware of all of these things. And they have to understand, they have to read, they have to engage in the technology and really understand, what's going on, so they can bring that to bear when they have these conversations with their constituents and their stakeholders. That's one way. The other way is to listen, going back to communication, is to listen to the needs of these stakeholders. What does the operation need from IT? What are the patients needing in terms of, the user experience? Consumerism plays a role in this. What are the rating agencies? What are the associations doing and needing? Frankly, what are the communities that you're operating within need in terms of, COVID response, telehealth, engagement, all of that. So as a CIO, you have to know and be on the pulse with the business practices and understand what's really going on, and not just find out about them after the fact.
Yeah.
Right? Because
Definitely.
when you're creating these initiatives and driving them forward, you have to really know the impact of these initiatives on all of the stakeholders in your domain. And also the reverse of that too, the impact on your initiatives by the outside forces and the environment that you're operating within.
Yeah. Well, at Divurgent, you work with some of the leading health systems doing consulting, implementations, et cetera. So you must have a really interesting perspective in this regard. I mean, what do you really see as some of the most important digital initiatives that healthcare organizations should be focused on right now? Being able to talk with so many, what are most important?
It's actually quite varied. And as we work with different constituents and different organizations, we have different demands and different needs. And most of these needs and demands are stemming out of the response, not just to COVID and how it changed business practices in healthcare in general, but the return to work, the future of healthcare, the future of work. All of these things are compounded to create new demands. So for example, we work with a lot of clients that are really thinking about their digital strategy. And the CIO, in some cases, is not the first person to go to for these things. Some organizations have hired digital strategists, or that they've assigned that task to another person in the C-suite. So as a CIO, you have to really align yourself with that and better understand the domain expertise and to bring new things to the table. In other cases, we have clients that are really looking at new innovations in the healthcare space, such as the hospital at home, or infusing IoT into their care management process. All of these things have repercussions. They have security and privacy repercussions. They have implementation, monitoring repercussions, costs, of course. So the CIO and their organization have to really understand the value drivers behind this and be able to interpret what that is, display what that is, and educate the rest of their organization on not just the cost and the timeline, but the ROI. Again, going back to what is this going to do to expanding access, improving quality, and reducing cost? The three-legged stool in healthcare, right?
Yeah. So how do you suggest that a CIO effectively does that, to quantify and really qualify the value of these digital health projects? Do you have any tips for success in being able to quantify and qualify? Because, I think we see some of the benefits, we hear about the benefits, but any suggestions there for them?
I think there are different ways of looking at this. Certainly, a lot of organizations are spending a lot of money and time and effort on analytics, right, to understand the value and the cost of everything that's happening. So we have that element, but there's no substitution for communication again, right? Knowing what's important for your stakeholders, be it patients, be it doctors, nurses, administrators, understand what they need and be able to tell a good story, tell the story of this implementation that you just did. Don't talk about it in terms of zeros and ones, but talk about it in terms of the impact of that implementation. So for example, if you're implementing a hospital at home model or a continuous monitoring operation for your patients, you have to be able to explain how that's, for example, impacting access, increasing access to your patients, driving more revenue, maybe more engagement with your clinicians via remote means like Zoom or others. So that's one way to measure that impact. Another way to measure that impact is in patient satisfaction. There's a lot of surveys out there. That's one way to do it, quantitatively, if you want to look at it that way, or anecdotally and qualitatively, if you want to look at it that way. But the real measurement of patient experience is returned patients, captive patients who come back, to you, not just only when they need you, but for regular checkups, for elective procedures and things like that. So that's from a provider perspective. From a payer perspective, it's the same thing, right? A CIO in the payer space should be thinking about how can we improve operations, increase throughput, reduce costs, improve access, and monitor and measure quality across our stakeholders, and clinicians engaged with us. So it is a lot. It is a lot.
Definitely.
And we have to be able to not just educate and support CIOs in this effort, but also guide and provide the feedback.
Yeah. I loved where you started with it. And it's about communication. And there's no more powerful communication than a good story, right?
That's right.
But then
That's
to
right.
tie it in with something else you said is you need to know those people. And by connecting with those people, you understand the stories of the impact the technology you implemented, whatever you're working on. So I think it's fascinating that you connected both spending time with the people. I mean, is that the best way to get the stories, is spending time with them to understand it? So then you have the stories to tell everyone else to push it forward.
Absolutely. I mean, it's about relationship building. And again, putting yourself in the other person's shoes. What do they need? What do they want to hear? Be able to understand that and in turn, give it to them. If you give it to them the way they want to hear it, they will be much more apt to support and understand where you're coming from.
Yeah.
I learned that a lot by teaching as a professor, at American University. You can tell students all kinds of things, right? But do they actually hear you? Right? That's the question. Yeah. It's the same thing. You can tell people all kinds of things, but you have to really make sure that you have them tell it back to you in the way they understood it.
Yeah.
It's the same way. That's where communication is really important.
Yeah. What a powerful message. I love it. Thanks for sharing that. So if people want to learn more about Divurgent, where can they go?
Well, certainly, they can check us out on our website through our various social media, properties as well, LinkedIn, Twitter, etc. But there's no, again, just like communication is so important, there's no substitute to having a conversation, right? So if you're a CIO, if you're interested in this space, if you're interested in about transformation, whether it's talent transformation, digital transformation, or anything else in between, give us a call, have a conversation. Let's talk about how we can hear and understand your business imperatives. And then how do we bring that to bear in terms of solutions that would help you advance, not just in your career, but advance your organization to be a better steward of patients and a better innovator in this healthcare IT space.
That's great. Well, and I know Divurgent puts on some good events, brings together leaders, puts out a lot of thought leadership. I'm sure everyone can check it out at divurgent.com. Thanks so much, Sam. I appreciate you taking the time to talk with us here. And thanks everyone for watching. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com. Thanks, Sam.
Thank you for having me.